Eli Lilly is teaming up with actor Lowe to encourage more people battling cancer to join clinical trials. As NBC's Dr. Akshay Syal explains, it's a major challenge right now for researchers.
I'm not this to you. I'm working.
You're done working.
I'm not done working.
He's one of Hollywood's most recognizable faces.
Welcome aboard, Mr. Secretary.
From teen idol to dramatic actor to comedy star, Lowe has proven that he can play it all. Now, he's stepping into a new role, working with pharmaceutical giant Eli Lilly to encourage more cancer patients to enroll in clinical trials, a major challenge for cancer researchers.
My great-grandma, my grandma, and my mother all had breast cancer, all eventually passed from breast cancer.
Their battles with cancer were all happening just as his acting career was taking off.
I'm starring in all these movies, and then I would come home and I would be, dealing with my grandma, and then later with my mother. And it reminds you of what's important.
Roughly 2 million people will be diagnosed with cancer in the United States just this year. Cancer treatment has advanced dramatically in recent decades, but doctors say many promising therapies aren't reaching patients.
Less than 5% of people, especially the cancer population, are enrolling into clinical trials.
Wow.
And this is problematic.
Dr. Edward Kim is an oncologist and system director of clinical trials at City of Hope in California. He says a dramatic increase in enrollment is needed to get newer treatments to patients.
Every time we hear about a story about a new groundbreaking therapy, that comes from a clinical trial.
Are there potentially life-saving treatments that are sitting out on a shelf somewhere because these trials can't get off the ground?
That is a struggle. We don't know until we try, and that's where the science really drives it.
In fact, up to 20% of clinical trials fail because not enough patients enroll. He says doctors and patients may not even know that a trial exists. 25-year-old Serene Hesri was diagnosed with lymphoma during the pandemic. After a relapse, she turned to a clinical trial at City of Hope, hoping for another chance.
Was there any part of you that's apprehensive about doing an entirely experimental treatment?
No. I asked my oncologist at the time, truly, what do you recommend? She told me, if you were my daughter, I would tell my daughter to do this clinical trial.
Do you think you're alive today because of a trial?
Yes. Yeah, I do.
What are you guys doing on the provider side to sort of increase awareness about getting patients in trials?
Awareness and finding it in a specific manner are really big problems right now. There are resources like clinicaltrials.gov, but frankly, each center has to try and do this work on its own.
Lowe says a clinical trial gave his grandmother almost 20 years that she wouldn't have had.
What do you think Grandma Mim would say if she knew you were doing this?
She would say, cut your hair, probably. She would be so surprised and so happy that we're talking about her, and that her story is being shown as an example of what clinical trials can be. She would be, I'm sure, thrilled.